He's like, I'm not a PT. I was like, what? He's like, well, I'm a muscle activation specialist. I was like, what the f is that?
These people, all they're doing is making it worse. And PTs are to blame for a lot of this stuff too. There's a lot of PT haters out there that will come and crash down. You'd be like, this is not within the scope of practice. What are we doing? I say, shame on you.
And now, 2 years later,
Yep.
at least once a week, I have a physical therapist calling me, asking me about it,
Sure.
asking me to speak about it, asking me to come in to educate about it. All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott, and we're in the studio today with Chad Burnham from
Yes, sir.
ProForm Physical Therapy. He's, if you're watching, he's quite a large man. Are you a pro bodybuilder?
I'm not pro, but I have competed on the amateur circuit just a few times. So
Okay.
I'm hoping to do another show this October, so we'll see. But no, I'm not pro. I don't plan on being pro. So
No?
I mean, if it happens, that'd be really cool. But I'm kind of old now, so I'm like going to be 41 in the next month. So that's, it's not really ideal when you're competing against 25 and 30-year-olds. So, but I still have a master's. I can still compete in masters. So that's my goal this year. So we'll see what happens.
And I mean, I've seen like you've posting your progress photos. Like you're still making a ton of progress at 41.
Totally. And honestly, a lot of that is the last like few years is working not only with a coach, but also like getting into more like male optimization or hormone optimization, if you will. And I know we'll probably dive into that a little bit today. So, but that's been a huge thing for me and kind of diving a little bit deeper into what's going on underneath to find out like how I can best maximize not only my results, but my health at the same time. So, yeah, that's been the huge difference in the last few years.
And so, yeah, so when you say like getting into levels of it, so what got you to go that route with hormone optimization?
Yeah,
like,
great question.
do you use testosterone and things like that?
Yeah, of course. Yeah. And so actually the short story is my dad has prostate cancer.
Okay.
And so for me, that was a concern. And what I ended up doing is after I started working with the coach, got involved with her connections into working with a doctor that could actually look a little bit deeper into my hormones. Because I'm like, all right, there's obviously probably going to be something going on here. I want to know what that is. And if we can prevent this from number one happening or getting worse, let's do that. And I ended up getting the test and everything came back and shit, my prostate looked amazing, but my thyroid was an issue. And this is totally something that came out of the blue. And I was asymptomatic and the results actually showed that I had Hashimoto's, which is kind of interesting because I was not expecting that. And it's not like anything that I can't deal with. It's basically like I just have to, take a hormone pill pretty much every day. And that's just what it is, as well as adjusting what I eat and, kind of improving those levels as we go on. Now it's been 3 years and my levels are solid. They're stable. You know what I mean? And even my antibodies are stable. So we're kind of just keeping an eye on that. And that's also super important with anytime I do like, a bodybuilding show where I'm dieting down, like thyroid is a big issue. So that's something that I want to make sure that, my doctor is keeping a close eye on, throughout the year. Were
you asymptomatic? And then once you started treatment, did you realize you had symptoms that you weren't even aware of?
It's funny. No? I do notice more energy now that I've been on the thyroid medication, but honestly, like I didn't really notice too much difference in the beginning. And a lot of that was trial and error because you start off slow and then you titrate and then you find out you're going up a little too high and then you got to bring it back down because sometimes you can go a little hypo before you go hyper. So it's one of those things where I kind of felt like I was almost feeling worse, and which shouldn't be the case. So we had to titrate back down. And then now I actually feel we've got it at a pretty stable level where I feel good all the time.
So were you hyperthyroid with Hashimoto's?
I was hypo. So because it's, okay. Yeah, but you can go hyper. From what I was told, like, and I'm not even sure if this is true, but apparently it can have the reverse effect when you're going through like hormone therapy. I didn't know this. This could be not true. I don't know. Okay. But what I was noticing is the way that like my gut was feeling, like digestion, all that other stuff. Mm-hmm. And I knew that was not right. So, and that was basically a symptom of the thyroid medication just being too high.
And how has that diagnosis and things like changed? Has it changed your perspective at all on managing your own health? And
it really has.
And then even just how you view medical care and our experiences with all that.
It has. And it's also affected the way that I look at my own patients too, because it's so different how I go about looking at a patient now, where once I develop a rapport with the patient and, I find that, okay, there might be other things going on here besides your shoulder or your knee pain that we probably could address. It's usually part of my practice now where it's like, hey, probably a good idea that we get our labs checked just to make sure that everything else looks okay. Because I want to make sure that not only are you improving in rehab, but you're just improving in life, because all that stuff, you know, as well as I know that pain can be generated from a multitude of variables. So why don't we just see if we can kind of, maximize or optimize those variables and see if we can kind of improve you in all ways, So in some of those symptoms too, like in terms of, like I have a great story of a patient that I've had where he had symptoms of, feeling, tired, less energy. He owns a business. And we kind of went through and I was like, dude, you should probably get your labs checked. Come to find out, the guy had like very, very low T. He's been on testosterone therapy for the last like 2 years, and it's changed his life. And he's at the point now where he just comes in. I don't even think he has pain anymore. He just comes in because we just have that relationship. And I've changed his life so much that he just wants to keep on with the preventative maintenance, however it may fit him, So stuff like that is really, really cool to see. And I'm glad that through my experience, as well as through like my education and my background, I feel like I can give people that option, in addition to the physical therapy that we also offer.
Yeah, I think it's huge. And there's still a huge stigma behind it.
Totally.
And still fighting with doctors about it. And like doctors don't always understand. And you're like, hey, you need to get your levels checked. And it's really hard sometimes too, because you want to just send them into the medical system and trust that they're going to get what they need.
Right.
But there's still plenty of doctors that are like, no, this isn't for you. Or
That's
no,
right.
there's safety issues with it. And it's like, where are they? Because we're not seeing them. And when you work with doctors that do this every day, it's very easy to see that people improve their health, they've improved their biomarkers, they're improving longevity.
That's right.
But we still have all these things. And it's like, yeah, don't just go to your PCP for this. It's like,
right.
Why not? Like, I trust my doctor, or I should trust my doctor. It's like, well, can we? It's like, I don't know. It's like, how do you get people to go to the right person?
That's
like,
right.
Do you have to preface them with like, hey, this person might not give you what you expect, or they're not going to give you the right answer?
Dude, I always tell people too, it's, your GP is good for a few things. And honestly, like that's my goal this year. I got to get back on the GP because I don't have one. And for that main reason, but I have to be in the system for some reason. I don't know what that reason is yet. And I hope I never have to find out. But it's one of those situations where I tell my patients, hey, listen, if you want good care, it's very unfortunate that you have to kind of go outside the network to get that good care. Like, for example, going back on TRT, like I have a patient right now that is going through, he's a training client, but he just got diagnosed with prostate cancer, and he's kind of reaching out to me because he knows that I kind of work in that space where I'm like helping people not only with training and nutrition, but also kind of on the back end with the labs. And he just got his labs back. And this guy also has low T. Now he's talked about this with his urologist. Mm-hmm. You would think, okay, it's a urologist. He's a specialist, right? Like it's got to mean something. It's got to carry some weight. It doesn't actually. It's actually worse. And it's so bad that he's like, nope, I don't want to put you on any hormones, anything right now, because testosterone will actually feed the cancer, which is actually 100% false. And I know this for not only the fact that I've done my research, but also I've talked to many other urologists in the field that specialize in hormone optimization. And that's actually the exact opposite. Yeah. Which really sucks for this guy, because this guy will take this, and I get it. Like he probably should take the doctor's word for it. Knowing him, like he doesn't know me from a hole in the wall. Like I'm a physical therapist. This guy's a medical doctor. Like I get it.
We're fake doctors.
Yeah. Pretty much. Yeah. So it's like, I totally understand, but also I'm like, dude, please. And I like read the research, and then you have to be your own advocate. Like find another urologist that's going to be like young, probably, and maybe a little bit more open-minded to the fact that, okay, maybe I should probably look outside the box here. And a lot of doctors are so stuck in the system that they just kind of go with what they know, and that's it. They don't reach outside the box, which kind of really sucks, and that's just kind of how it is nowadays. Yeah.
I dealt with the same thing with my dad. He had symptoms of low testosterone. He went to his primary care. I saw his labs. I was like, Dad, they said you're fine. He's like, yeah. I was like, you're not. Like your testosterone's like 190, and
yeah,
like, he's 70, so it's like okay. But I was like, hey, you're not sleeping well. You're always complaining. You're tired. Your brain doesn't always work like it was.
Right.
Like you're just repeating things or taking longer to figure things out. And I'm like, this is all probably from that. And so I was like, let's bring you to my functional medicine doctor that also does some hormone stuff. And we did that. It was like, oh, yeah, your testosterone's low, like you're a candidate, but his PSA had also like elevated a lot.
Of course.
And so we went down the whole road of looking at that, and same thing, like the urologist was like, no, like he's not a candidate for this. And it's like, what? And it's like, well, and he has AFib, so like it's going to put him at increased risk of a stroke. And I don't know,
which is also not true.
Yeah, I don't know what
on AFib, TRT dosage.
Yeah. So I was just like, man, and he went to, all right, let's. So then she was like, well, there's this other doctor that like that knows a little bit more about this. But it's like, wait, you're a urologist and you don't know about the testosterone that's made in the urology, real estate area. Yeah. So yeah, it's just brutal. And then he went to another doctor that was like, yeah, maybe let's wait and see. He had some cardiac stuff that they wanted to clear first with like an ablation and things, but
yeah,
it's crazy. And then like you were saying, like we're fake doctors of like our perception is kind of odd, I guess now. And I'm always rethinking it because like my mom always tells people, she's super proud. She's like, my son's a doctor. I'm like, I'm not a mom.
Don't do that.
I'm like if we're on a plane and someone goes down, like, yeah, I've been trained in CPR, but emergency medical situations, right, not my thing.
Totally.
However, in the same breath, it's like, there's a lot of things we don't know and do, but then there's a whole lot in this field now I am getting more and more into with managing people's lifestyles, consulting them on like, all right, this doctor said that, like, we know with current evidence, that's not true. Yeah. And a big problem is like, these doctors don't have time. Where me and you, like, we spend an hour with people one-on-one, and it's like, oh, there's all these different issues. And like, my big thing is like, I have a girl now that's going through so much like autoimmune stuff, cardiac, bones, joints, migraines, IBS. Yeah. Like, I'm like, and she's been to, and I'm going to all her doctor's appointments with her now at this point.
Sure.
And it's like, we've seen the rheumatologist, the cardiologist, we've gotten brain MRIs. She's getting a heart MRI, CAT scans, CT scans, or those same thing, but you get it.
Yep.
And everyone's just looking at that one region or body system, and no one's taken everything. And I'm kind of sitting in the background here, like on a whiteboard going like, okay, this person thinks this person thinks this. I know you're dealing with this. Like, you haven't communicated that with the provider. We need to get this across to all of them. And it's like the holistic approach to medicine that we're the ones doing more of than anyone else.
Sure.
Which is kind of crazy to me. And it's like, oh, well, yeah, we are doctors.
Right.
We are doing a lot for people. We do know a lot about healthcare. And even like, I'm looking up the differential diagnosis of like, is it MCAS syndrome with different things? Is it POTS syndrome? Is it ankylosing spondylitis? Like all these different things.
Sure.
It's crazy. All the pieces to that.
Dude, to your point too, and I know you do this as well, but I really like to walk the line with what we do. And if the scope of practice and the line is right here, I like to be on it. I never like to cross it, but I also know my boundaries. So it's like, I feel like with what we do and what we're talking about right now is completely within the scope of our practice. Yeah. And for us to not offer this, we're providing a disservice to our patients. So it's some people would call it hairy, but I don't think that. And maybe I did in the beginning, but the more that I do it, I realize that it really needs to be more of a thing. And I know in physical therapy, we're very, very risk adverse. And I know, especially in the traditional method of care, I know a lot of PTs would never even kind of jump to this type because they don't think it's within their scope.
Yeah.
But I disagree. And I think it's not like we're trying to say, hey, this is what you need to do, but we can be a resource for you like everybody else. Like I have a resource for a doctor that can help you with this or that. You know what I mean?
Yeah.
But I want to be able to know and to be able to identify these problems so that I can provide you with the correct resource.
Yeah.
Otherwise, people are going to be like in limbo, like they always are, Mm-hmm. And what are we doing besides treating pain? Like, I feel like that's just not good enough nowadays. And if like you're just still treating pain or treating like a limitation in mobility or function, that's cool. Like I understand that that's what we need to do, but let's try to take it a step further and see if we can better people's lives in other ways. Right. So absolutely. I don't know. That's the way that I look at it now. Completely different.
Yeah. It's funny. Like we were mentioned before, like I had people are so quick to jump at you for different things. Totally. in the approach and whatever. Like I'm a strength coach and a physical therapist. I have a nutrition background as well. And I posted a thing about creatine the other day because I had my old history teacher reached out to me and was like, hey, my 16-year-old is training. He asked me about creatine. He's like, from what I've read, it's relatively safe, but I wanted your thoughts on it. I was like, cool. I was like, I asked a little bit about, how much is he training? How serious is it? Why does he want to take it? And, does he have kidney disease, anything like this?
Sure.
No. Okay. And I put a story up about it. So I kind of gave everyone information because how many times you get asked about creatine?
Every day.
At least,
every day.
Yeah, at least once a week.
At least.
So I put this thing up and this dietitian was like, based on what? And I just wrote back, science.
But seriously.
And they haven't answered me. And I was like, cool. Like, but it's like, why can't I talk about nutrition?
Totally.
Granted, like, we can't create custom meal plans for people because that is out of our scope. Correct. But I can tell you the relative, risk profile of taking creatine, what its benefits are, what the potential side effects would be. I don't know why we can't do that as physical therapists.
Yeah, totally, 1,000%. And it's only going to help their recovery during rehab. Yeah. And not for nothing. Like, since you brought up the creatine, it's probably the most researched supplement on the market. And I don't think there's any research out there to show that it's not safe. In pretty much like normal human consumption with using it for improving, whether it be skeletal muscle mass, which is not like a great use of creatine, but it does provide you with energy, but it's also a great like nootropic, that not a lot of people know about. Mm-hmm. And I honestly am seeing the research nowadays, and it's like, we used to think that, 5 grams a day was pretty good, but the research is now showing 10 to 15. So really, yeah, totally. And so, and it's not like, I have a lot of people that will ask me, and same to you, like they'll ask me, my son's taking this, my son's taking that. It's like creatine, whatever. Like, it's not that much of a big deal. Like you said, as long as you're checking the boxes, my big thing is if you're going to increase the dose on creatine, just make sure that you're titrating it up slowly, because not everybody can tolerate it. In terms of like being able to like some people will have gut issues with it if it's really in a higher dosage, like 15 to 20 grams. And usually I'll say, don't take it all at once. Just try to take it like maybe microdose it throughout the day. Like, I'll take it in the morning with my shake, and then I'll take it like post workout. You know what I mean? So, and I don't have any problems. I think that whole water retention thing is kind of like a whole myth from the past. It is possible, but it's not like what people say it is, And I remember even growing up when I was in like high school, creatine was like a steroid. Creatine was like, oh my God, you're on creatine, bro. Now it's like everybody and their mom takes creatine. It's like a multivitamin.
Yeah, so. It really is. It's like, you're at risk for Alzheimer's, take creatine. Yeah. You get osteoporosis, take creatine.
It's like, Alzheimer's, Parkinson's, like all these great things. Yeah.
And no, that was totally the thing back. And totally. Then, like, you thought you saw yourself like bloating up. But, like, it was cool just because you got a little bigger.
Yeah.
But I put that on my thing too. I was like, they say it bloats you. I was like, I don't notice a difference when I'm on it or off it.
Nope.
Not that I'm that well defined yet to be there anyways. But
I don't notice it.
I put that. And then like, this one person likes to attack me for talking about nutrition. Like, I posted a story the week before about my patient that wants to build hypertrophy and go on all these peptides and do all this. And I was like, hey, why do you have all this eczema all over your body? Not just like on your hands, but like it's on your back, it's on your glutes, it's on your quads. It's like, I have like a gluten sensitivity. I was like, you eat gluten every day? It's like, yeah. I was like, all right, let's
maybe start there.
I was like, so I posted the thing and was like, hey, like, if you're dealing with all these things, like, we got to cover the fundamentals first and like foundationally be in a good place. Because if you're taking peptides on top of just like poisoning your body with toxins that it's literally trying to get rid of as much as it can and it's failing at it, just eliminate that.
1,000%.
And she was like, refer to a dietitian. And I was like, for what? Like, why can't I tell someone that it's pretty logical that, okay, every time you eat gluten, this happens. And if you don't eat gluten, it all goes away and you're fine. Well, let's stop eating gluten.
That's right.
Granted, dietitians have their place, but I don't think there's any reason I can't make that logical judgment with our background to help someone in the healing process, in the longevity process, in the, just quality of life and like not having skin rashes all day.
Yep. That's a good point too. Like, how many people do you talk to are like, oh, I want to take this, that, and the other thing. It's like, cool. I have no problem with you taking that stuff, but why don't we kind of dial in the non-negotiables first? You know, like you said,
Yeah.
all right, hey, I have a gluten sensitivity. You're eating gluten? Yes. Okay, well, let's stop eating gluten first. Let's just see what happens with that.
Yeah.
You know, like how many people don't get enough sleep? How many people, you know, don't take the time to like reduce stress and cortisol? Like all this other stuff that you don't take enough time for. It's like, hey, I want to, you know, improve muscle mass in the gym, but I don't eat enough. Like I don't eat enough protein. All right, maybe my nutrition's not on point. Maybe we should start there, you know, because you have so many people that either want to do peptides or do like TRT. And I can only say what I've heard. I can only say what resources I've heard from. You know, this is not coming from me personally, but it's like most people won't even prescribe you TRT if you don't have your shit in check. Like if you're 300 pounds overweight, odds are TRT is not going to really help you. Like if anything, it's going against you because TRT has a better response in your body. Technically, when you're below, from what I've been told, technically when you're below 15% body fat, or anywhere between 15 to 18. But like if you're 25, 30% body fat and you're starting TRT, like good for you, that's great. But if you're not dialing in everything else, you're really not taking advantage of the hormone replacement. So it's like, I think people need to work and they find that it's like a waste of their time to work on these things, but it's really not, you know, like sleep is so important. I did the same thing. Like even up until 5 years ago, I was like, dude, sleep is just, I don't need any more sleep. I'm one of those guys that can survive on 3 to 4 hours. Well, dude, I get like 7 to 8 hours now. And I know like, I don't always get that, but I usually average around 7.5 hours. I feel so much better now than I did 5 years ago when I was getting 4.5 hours of sleep.
You're really sleeping 4.5 hours?
Totally. Yeah. Yeah. Because I'd go to bed at like 11 and I'd wake up at 4:30 every morning. You know, I'd do the whole like morning routine. I'd go sauna. I'd come out of the sauna. I didn't journal or anything like that, but like I took my time getting ready in the morning, you know, but sauna was a big thing. Like I used to do sauna in the morning, like almost every day for like 45 minutes.
Way better sleeping.
And I'm like, dude, why am I doing that? Like I can get more out of my body if I just get an extra hour of sleep than spending time in the sauna tired. It makes no sense. So
dehydrating yourself.
Totally. Yeah. But you see that all the time, you know, everybody wants to do a morning routine. That's cool. But just make sure you're checking the boxes first, because if you're not, it's kind of a waste of time.
Yeah, that's the thing too with like the biohacking and things like everyone's into, and that's cool, and I love that stuff too. Like, I had a cold plunge until it broke last year. I spent $4,500 on this super, bougie thing, and it was awesome. I had it out back on the deck, and I'd be out there, and like, the moms would be walking the kids to the bus stop in the morning. I'm jumping in the cold water, and it's 40 degrees out, and I'm like, what's this crazy guy doing? I was doing all that. And like that, all that stuff's cool. But at the end of the day, it's like, if we're not sleeping well and everything else and hydrating and just, stress management, it's like, that doesn't matter that much.
No.
If anything, it's like, if you're not sleeping all that, like, even like when you're sick, we know don't cold plunge.
That's right.
Because it makes you worse.
That's right.
So it's another stress to the body that we're just adding sometimes.
Totally.
And yeah, there's just so many pieces to that. But yeah, as far as our scope goes, there's definitely more we can do that. And why do you think like people like me and you are pushing those boundaries where a lot of PTs aren't?
Yeah.
What's wrong with us?
Yeah. Good question. And you know what? Like, so I always tell this to people too. Like, I like to be the elephant in the room. I like to be the unicorn, and that's just me. And I can tell you're the same way. So I don't have a problem being different. I actually prefer that way. So I guess a lot of people have a tough time with change because they're afraid of what people may think. Nobody wants to be judged. I get it. Right.
Yeah.
But the second you can feel better about not caring what people think, I think that's where it comes really down to who's really ready for it and who's not. I don't really care if people think that I'm outside of my scope. That's fine. You can think that. I know that I'm not, that I'm not. So it's like, it's one of those things where I think you just have to keep on telling yourself, all right, I'm doing this for myself, but I'm also doing this for my patients. Like, I don't really care what anybody else thinks, and I think a lot of people, it's funny because you'll see a lot of the haters that will hate on you for that. And it's like, these people only spend their time hating on other people. You know what I mean? They don't post anything to help people. Like, I put stuff out there. You put stuff out there to help people. These people, all they're doing is making it worse. And PTs are to blame for a lot of this stuff too. There's a lot of PT haters out there that will come and crash down. You'd be like, this is not within the scope of practice. What are we doing? I say, shame on you. I was like, you're making the profession worse. Yeah. Like, you are holding us back. Credibility, everything. Like, you want to know why you're not getting paid a lot? You're the reason. You're the reason why reimbursement sucks. And you're the reason why we don't get the credibility we deserve. And so, like, I don't have a problem with it. Like, I really don't.
Yeah, I agree. Yeah, that whole piece is just there's a lot to
yeah.
it. And I think to the piece where we can push the scope, like I've always kind of too, like I've always beat to my own drum. I've always been a little bit different or wanted
Sure.
to just test the waters of like, okay, well, everyone's doing this. Like, I want to go the other road for whatever reason. Like, since I was a little kid,
Totally.
it was like, I didn't want to necessarily play team sports. I was a musician in a band and like did extreme sports instead of, I played team sports too, but I always want to do these different things. I want to be a weightlifter instead of like a bodybuilder because it's different. Not everyone's doing it.
Yeah.
Go into murky waters with things. And like, I remember even like 10 years ago when I was coming out of school or finishing school, it was like dry needling is you're a bad person if you do it because you're making people depend on you and the nocebo effect and this and that and the false narratives and blah, blah, blah. And I was like, look, this shit works when it's done to me. I feel way better.
Yep.
I have chronic pain.
2,000 years later.
All right, sorry for the brief pause. We my computer wanted to reload the entire page, and I didn't know what's about to happen.
Technology.
So I had to defuse the bomb. What the fuck was I saying?
I don't even remember now.
Oh, pushing the scope of practice.
That's right.
You
were talking about dry needling.
Dry needling. It was like, you're a bad person. I was like, look, this shit works for me. Anecdotally, I see it. Acupuncture has been around for 2,000 years.
Sure.
And people swear by it. Not that we do acupuncture, but it is a source of it. And then patients are calling me asking for it. So why can't I do it for them?
That's right.
And now it's in the clinical practice guidelines for a lot of different conditions that we need to use it.
That's right.
And then 2 years ago, I was one of the first to kind of start pioneering shockwave therapy.
Yep.
And I had PT students messaging me, telling me, take that thing off. It's a placebo machine, this and that. Like, basically telling me to go fuck myself, and I was a horrible person for having this and like promoting this service. And I was like, okay, look at the research.
Here we are now.
And now 2 years later, at least once a week, I have a physical therapist calling me, asking me about it, asking me to speak about it, asking me to come in to educate about it, asking if their patient would be good for it, if they can refer them to us. It's like, yeah, come on, let's go. Bring them all in. I was like, I will all day now stand on like, if there's a potential for something to work, why can't we test those waters?
That's right.
And maybe it won't.
Right.
We're always playing the game of risk here in business, but like, why can't we be open-minded to trying new things? And I think that's one of the things I've had a problem with in our field is like, I think it's changing a little bit now, but when I was finishing school, so I graduated in 2017, but it was like so heavy on evidence-based practice. But the fact that it was so heavy on evidence-based practice, anything you used that didn't have strong evidence that it did work, we threw out. And the problem with that is there's new theories that need to be tested.
That's right.
And if no one's doing it, like if we're waiting 10 years to prove that dry needling works, there's 10 years of patients that like
that you could have helped.
That I could have helped.
Totally.
And it's like, damn it. Why are we doing this?
And also a lot of the stuff that we used to do or that some providers still do that was never proved to be effective is still being used today. And that's okay. You know what I mean?
Like ultrasound.
You know what I mean?
Yeah.
So like ultrasound is totally okay to use, totally placebo, doesn't work, but that's okay.
I ask people all the time, like, so what was your previous physical therapy? I'm like, what did they do? They're like, they did this thing and they put this thing on me. I was like, was it ultrasound? They're like, yeah, I think so. I'm like, look, that fucking machine is just as effective unplugged from the wall as plugged in. Totally. And there's literally studies that like did that and showed it. And they're like, really? I'm like, yeah. Like, why would they do that? I was like, they can bill your insurance company for it.
That's right.
And AID can do it. It's cheaper.
Yep.
And they can go see someone else while I pay someone minimum wage to do this to you.
1,000%. That's really what it is. It's just a time suck. And it's funny because not only because I graduated a little bit earlier than you, and ultrasound was very much a thing. I mean, it still kind of is, but it was even more so then.
Yeah.
And I look back on it. I'm like, man, I can't believe I was ever doing that. And right when I got rid of that, then cold laser came out. I was like, all right, I got to do cold laser. So I got a cold laser machine. I'm like, this is going to be the coolest thing ever. I used it like 3 times and I'm like, wow, this thing really didn't do much at all either. That I thought it would be more effective, but geez, I could probably spend my time, that 10 minutes I was doing laser, probably could have spent my time doing something else that would be more effective for these patients, you know? So, but I tried it, you know? So it's like, but then like you said, dry needling came along. I'm like, wow, this is actually pretty good. And I took it back in 2013 and I was like, man, it was like nobody doing it back then. And I was really hesitant to do it. And it was one of those things.
You were one of the first then.
Totally. It was one of the things that kind of like came out and everybody was like really hating on it. And I was like, you know what? Screw it. I'm going to do it. What's the worst that can happen? And then I was like, all right, even if I get dry needling certified, like how am I going to convince these patients that it's okay for me to stick a needle in them? Like who would want to do that?
Yeah.
You know, I don't think I've only had, I might have only had maybe 2 people decline dry needling in my like last 15 years. And it's kind of wild because like I thought that would have gone the other way, but when people are in pain, they'll do anything to get out of pain.
Yeah.
You know, even if it means sticking a needle in them multiple times. So
yeah,
it does work. It really does.
The other thing though too that's tough is in school we're not really taught to be a good clinician.
That's right.
And people don't understand that. And I try to tell students this all the time too. It's like, I thought when I was an undergrad and I was getting into PT school, I was like, I'm going to come out, I'm going to know everything about the movement system. Yeah. And then I got done. I was like, I just got introduced to so many different methods and systems and principles. And this guy's doing this and this. And I was like, I didn't think about that. Or like, what does that mean? And you're like, fuck, I know nothing.
Yeah.
It's like, I know how to document really well. I know how to not get sued. I know how to pass exams really well now.
Yep.
And take tests. But I didn't know shit about being a clinician.
That's right.
And that whole like learning process is just, it's such an interesting field where we know so much about so many different fields, and there's a variety of things we can treat and we have to know about. But the skill of being a good clinician and actually getting someone better, like I think we have to be more specific within our scope and put time into those certain areas we want to go into with it. And it's just like with Shockwave now, I'm seeing this huge issue come up where it's a really cool, interesting field with so much science and evidence coming out for it. And people are like, oh, cool, it's supported. Let's get one.
Right.
And that can be really good or bad, because now I'm seeing people online on Instagram using these machines that don't have any formal training in it.
Sure.
That just bought a machine and said, let's roll.
Yep. And
I'm like, fuck, you're executing this completely wrong. You don't know the protocols. You're not even holding the thing the right way.
Yeah.
And then there's this whole thing with there's radial, like which is like a pressure wave that's not technically shockwave, but people call it shockwave.
I see.
And so for reference, like, and then people confuse it with ultrasound.
Right.
Or like ultrasound, I think is like the frequency is like 80 meters per second. Radial pressure wave is 200 meters per second. What we do with focused is 3,500.
Dang, that's the difference.
So it's 3 times the speed of sound. Yeah. You're blasting sound waves into the tissue. That being said, like I went to this clinic, I won't name them, but they do all kinds of different like regenerative alternative medicine stuff. And we do this, we do that. They do stem cells, they do blah, blah, blah. I was like, cool. I was like, yeah, we do shockwave. Like, oh, we do that too. I was like, oh, do you have a radial pressure wave or do you do focused? They're like, what?
Yeah, they didn't know what you're talking about.
I was like, we don't know? Like, no. I was like, well, where's your device? Like, it's in the drawer over there. I was like, in the drawer. And she goes,
those things are huge.
She pulls out this thing that looks like a sex toy almost. And I was like, where did you get that? She's like, we got it on Amazon. Oh, God. I was like, what did you pay? She's like, I don't know, like $800. I was like, oh, fuck. Yeah. That's the moment I was like, shit. I was like, I paid $50,000 for my device.
Yeah.
Not that then like I don't regret that decision.
Of course.
Because mine is, it's like 90% of the evidence for shockwave is done on the device we have. But I was like, oh God, like people are buying these things. And then I'm in a business mastermind group with a bunch of gym owners, and there's a few of us that are PTs as well. And one guy got this other company's device that I really dislike. And now I dislike this company even more because I was like, oh, well, he was asking me about hiring a PT. And then I was like, well, you are a PT. Like, why do you want to get a PT to do shockwave? He's like, I'm not a PT. I was like, what? He's like, well, I'm a muscle activation specialist. I was like, what the fuck is that? I was some run around like massage therapist. I was like, they gave you one of these? He's like, yeah. I was like, how? He's like, money talks. And I was like, great.
Oh,
I was like, because now we're just making a bad reputation for like this thing that can really help someone. But if the majority of people are just getting them with no regulation and they're just doing it, it's like, well, this sucks.
Yep.
Because now it's like, well, I did that and it didn't work. It's like, who did it? What was their training in it? What is their background with it? How long have they been doing it? You know,
Totally.
and
that's the problem too, because patients are going to go to these clinics and say, oh, shockwave doesn't work. Right.
Yeah.
And you're gonna be like, well, okay, well, why didn't it work? You know, like for example, like dry needling. Like if I have somebody that comes in that's had dry needling in the past, I'm like, hey, how'd it feel? Oh, it wasn't that bad. Then I know you didn't have dry needling, because it's not the most comfortable experience. So if it wasn't that bad, that tells me it probably wasn't done correctly, or it probably was like, maybe not really like dry needling. I don't know. It could have been acupuncture. So it's like, I don't know. It's one of those things where if like one person has a bad experience, even with like physical therapy, it's the same way. Like they have a bad experience with physical therapy. Now we're kind of all put under this umbrella of physical therapy, which kind of sucks. So, I mean, it would be nice if, you know, people could get on board a little bit more and do a little bit more of their research. And that's kind of like where you walk the line and you're just like, yeah, this one works. And I'm going to be, you know, a big advocate for this, you know, versus like people that are just like, oh, I just bought it off Amazon. You know, so that sucks.
yeah, it's so I'm really trying to like educate people on this stuff, because it's like, look,
Totally.
and even in the field, so like there's finally like they just put together like a regulatory board that's like, or an advisory board and council, which I'd like love to be on at some point.
Totally.
Because like we go to all these conferences, we do all this training, like I pay for my staff to go, and I'm like, let's be on top of science, let's be like with the current evidence. What's really cool about it though too is like I said, like, you know, going the other road and doing the things that other people haven't done. It's like the first few of these conferences I went to was like, this is so cool that like you're watching science as it like unfolds, because they recruit in these doctors that have been like doing this since it was kind of discovered in the 80s.
Sure.
When like these shockwave machines like took up this entire room.
Yep.
And like an old computer. But you get these like 8 experts up there, and it's like, well, we have a ton of strong evidence to support it, but there's not enough to say what's better, what's not right now. It's like,
Sure.
So this guy's like, I'm trying it this way. This guy's, I'll do it 5 days a week on someone. This guy's like, I'll only do it twice. One's doing it 3 times. I'll use this frequency. I'm using this energy. I don't like to go past this. And so it's really cool to like be part of seeing open-minded, you know, physicians, practitioners, surgeons using all this technology and being open with like, yeah, we don't know what's best yet. So like keep trialing and see what happens.
That's right.
Where like a lot of clinicians are like, nope, there's no evidence for that. It's like, can we try it? How much harm is there in trying it?
Really. So, I mean, I think that brings to the point too, like what you were saying is, you know, I think it's important once these kids get out of school that really do your research and look outside the box a little bit. And I usually tell people too, whenever they come out of school, it's like, you really learn everything once you get out of school, like whether it's through, you know, conferences you go to, or whether it's through like mentorships, or whether it's through, you know, like even just having like a good, you know, mentor in the clinic. Like that's like where it really comes down to, you know. And I always encourage like PTs to kind of new PTs to kind of look outside of the scope of PT. Like there aren't many PT conferences that I go to now, actually very, very little, if any. And
I've never been to one.
I've never. So I mean like PT specific, not like APTA. I still refuse to go to APTA. They're never going to change their ways, and I just don't want to be a part of it. If they do, maybe I'll take a gander, but I spend more of my time with strength conditioning conferences. I get way more out of that. Number one, it's more like our practice model, but I just feel like I get more out of it versus going and just seeing the same old lecture again and again and again. It's like, oh God, it's maybe you want to experience for the first time, fine, but like you have to look outside the scope a little bit if you want to feel like you're kind of doing something like, you know, different inside the scope of PT. Otherwise you're going to be like everybody else.
Yeah. And that's kind of what I wanted to pick your brain on too, is like, where do you see our field going, or where I guess people like me and you could take it in the future?
Yeah.
Because we're starting to push boundaries with things now. But how do we continue to do that in the future? Like something cool we just got is there's this nonprofit imaging company we're working with. So we can't order the MRIs technically ourselves, but if someone needs imaging, it's $600 is all they're going to pay, and they can still bill their insurance. So it might even be cheaper for them in the long run. But this company is fucking awesome. Like if I saw you right now and you came in and it's like, I fucked up my shoulder.
Yeah.
It's like, hey, bud, this happened 2 weeks ago to me. I was like, you need imaging. Like, I think you tore one of my MMA fighters. I was like, I think you tore your bicep. And then it turns out he tore his bicep and his pec and his labrum. But he got in that day.
Yeah.
He left my place, had an appointment there an hour and a half later.
No way.
Got his results before he even left the parking lot. I get the results. I get all the imaging. I can bring up the actual images, which like most people it's, oh, well, you got to come in, you got to get the disc.
Totally.
And usually the disc is fucking blank and nobody has.
Or you have to download software in order to see it. And everybody has Macs nowadays. Nobody can even read them.
Yeah. And I was like, I'm like, this is so cool that we get to do this now. And so it's, again, not that I cannot order MRI, but I call my girl up. I'm like, hey, I got this going on. Like, he needs this. He probably needs contrast. When can you get him in? Like, I'll fit him in an hour. It's like, cool. But outside of that, like, where do you see us evolving as a practice? Because just rubbing people's legs and
I totally. And I think you nailed it, man. Like, I think and it needs to be like stuff like this, for example, is what really needs to happen so that more people can start kind of pushing the line. I think the more people that push the line, ideas like stuff like this, like I didn't know that existed. So that's cool. I might look into something like that because that is definitely going to provide value to our patients. And how can we continue to kind of get on that line, but provide as much value as possible without it being like physical therapy, it's physical therapy, but it's like physical therapy plus, you know what I mean? So, so kind of in a way. So like, for example, like you have that, I have an affiliation with this company called Merrick Health, and that's the company that does all my lab work for me.
Yeah.
So it's like, I don't have to like, call your doctor. I don't have to go through all these loopholes, right? I can just say, here's a code, you can pay me. And then here's the code. And then within 24 hours, you're going to get a lab requisition. You're going to go to the lab and you're going to have your result in 3 days.
Mm-hmm.
Like, you don't have to wait 2 weeks to see a doctor. You don't have to go through all that bullshit. And it's like, now we can find out where we're going. Right. And again, that's not me saying, hey, listen, the lab's in my back room. You know what I mean? It's just saying, I have a resource for you, just like you have a resource for them.
Yeah.
And how can we best improve like our patients' outcomes? So I think like little things like that, we're going to find other ways that we can continue to kind of push this line. And maybe, hey, you never know, maybe someday we can get to the point where we can order MRIs. I mean, chiropractors can do it. So, I mean,
can they order MRIs?
They can, no, I think they can order them all. Well, they can do x-rays within their facility.
Yeah.
And then I believe they can order MRIs. I'm pretty sure. Yeah. They can order a lot of things actually. So, I mean, kind of funny story. My mom was going to go see a cardiologist in Missouri, because that's another out of network thing. She was getting run through the ringer with, and I don't know, like how were your stances with COVID, but like the vaccine was causing her issues. And so nobody would listen to her. Doctors weren't listening to her,
Yeah.
So I worked with this cardiologist that I met with at a conference actually. And he's completely out of network, but he's like the best of the best. And I'm like, Mom, you got to see this guy. And she's like, all right, fine, we'll go down. So we went down, and in order to do that, she had to get what's called a carotid CT, not carotid CT.
Calcium score?
A calcium score, thank you. And in order to do that, like,
we know our stuff.
CT calcium score, yeah. So so she had to get that. In order to get that, she had to get a referral. So instead of going through her doctor, I have a really good friend that's a chiropractor. And he's like, hey, man, I can totally order that for you. Where do you want to get it done? I was like, I don't know, Portsmouth Hospital. That one's pretty close. So he's like, all right, fine. I'll put the order in. She was there within 2 days, got it done. No problems. Didn't have to go to her doctor. Like, totally just did me a huge favor. And I'm like, man, wouldn't it be really cool if I could do that? You know what I mean? So it's like, why can't I do that? But you never know. Maybe in the future, maybe that comes to fruition. So, I mean, little things like that are cool. So it's just kind of one of those things where I think we just have to keep on pushing those boundaries and just see, like, maybe we get a better lobbying, maybe we get better like legislature, for PT, because right now we don't have like very good lobbying for PT. It's not good at all. And that's the reason why chiropractors like supersede us. They're way better at that. Everybody's like, why does everybody go to a chiropractor for low back pain? I'm like, dude, because they market well for low back pain. Yeah. We don't do shit. You know what I mean? So like, that's what it is.
We have an awful branding problem.
Totally.
In our fields. I took a spinal manipulation course through James Dunning's academy or whatever. And the guy that taught it, this guy, Ray Butts, Dr. Ray Butts is his name. Awesome dude. Great teacher, super passionate about this field. And before we got into it, he was like, look, he's like, I've been doing this for 20 years. I'm certified. He's very well published in the manipulation field too. Like he's one of the most credited authors out there about spinal manipulation. He's like, you could take this course and you can do this and learn this, but he's like, you have to get really fucking good at it.
Totally.
And he's like, we have a huge issue in our field. He's like, look around you. He's like, physical therapist is the last place people go.
Totally.
It's like, I hurt my shoulder or whatever. I'm going to go to my PCP. I'm going to go try to get a massage. I hurt my neck or my back. I'm going to go to the chiropractor.
Yep.
I feel weak. I'm going to go to see a personal trainer. I'm going to try yoga. I'm going to try all these things. And then somehow people, there's like, I had surgery. Okay.
I was going to say PT's post-op. That's it. Like you have to have surgery to see this.
And people think that's what it is. It's like, oh, we're just, we're there to rehab post-op hips, shoulders, and knees.
Sure.
And it's like, And it's like even like fucking personal trainers now are like corrective exercise specialists.
Totally.
Now. It's like, we're non-differentiated at all.
Yep.
It's like, we can be good at all of these things, but a lot of us aren't.
That's right.
So it's,
and to your point, like, and I think we've done that to ourselves as a profession, not only in the marketing thing, but also in the fact that like, how many PTs do you know of that actually practice what they preach? Like how many PTs that you know of that can actually instruct and correctly perform a good squat or a good hip hinge? You know what I mean? Like it's scary, right? And why do you think most people go to personal trainers? Because that's like, and I'm not saying they're any better. I'm just saying like, I'm sure they have a better idea and I say this with softly because I know really good personal trainers and I know really good PTs, but I also know really bad personal trainers, really bad PTs.
There's good, bad.
They're in every profession, right? So, but what I will say is that PTs don't have a really good grasp on exercise progression at all. You know, like we're taught, all right, these are the 4 exercises that we do and that's it. Like, and that's why I really encourage people to go outside the box and do all these things outside of PT, because like exercise progression for me was everything that I learned outside of the scope of PT. Like all the conferences, all the workshops that I took were all like taught by a fitness, trainer of some sorts, strength and conditioning coach, whatever. So it's like, it's really sad, but we've also done it to ourselves. But this is like we're at a turning point where a lot of people know that. And I think that a lot of PTs are starting to see that we really don't have a good grasp on this. And a lot of PTs or a lot of PT students that are going to come PTs, I think social media has probably helped, but also hurt us in a way. So I think it's helped in the fact that like you can see what's possible, but I also think that there's a lot of shit advice out there too. So it can go both ways. So obviously know who you're, getting your information from. So
yeah, I was teaching a course for a hospital recently and they had all of their outpatient physical therapists come to my facility to learn about integrating strength training and fitness into their practice.
Sure.
Which I thought was awesome.
Yep.
That they want to do that. And the guy that hired me knows me and he knows they could use some work in that area.
Sure.
And so I was going to cover like the basics of deadlifting, bench pressing, managing just people that do CrossFit and bodybuild and like different things and like the special considerations we need to make for people like this that a lot of people don't have an understanding, can't even have a conversation about, or you don't even know what a snatch is or what the difference between powerlifting and weightlifting is. And how do we just have a conversation? And so Brooke that I coach, that she's on Team USA and she's national champion, all that. She wants to be she's 17. She wants to be a physical therapist. She just wants to be like me, I guess.
Dude, that's going to make you feel pretty good. Like how many patients do you have that change their whole direction in life because of an amazing, PT or practitioner? Like it's cool. It's a cool feeling.
Yeah, it is cool. We have a good relationship, but I was like, hey, why don't you come in? I was like, you can see what a continuing ed course kind of looks like. And I was like, I don't know what population is going to walk in here. So like, if we want to cover like some of the Olympic weightlifting stuff and how to manage this, like you'd be a great like demo for me to have here. And as soon as everyone walked in, I was like, we're not doing Olympic lifting today. Like it's not going to happen. Way. And that's fine.
Yeah.
And like, it just like you get to a certain age, you can't Olympic lift anymore. It sucks.
Sure.
I mean, I'm even like on the cusp. And, but then 3/4 of the way through the day, I've got 30 PTs rolling around on the ground and stuff. And some of these people are looking up at Brooke. And I was like,
yeah.
And then she's like, what? I was like, just do your thing. Like if they're asking you questions, like answer.
Yeah.
And then I'm doing my thing again. I go back around and she's just like, she's coaching like 6 PTs
That's awesome.
that are asking her questions about exercise.
Absolutely.
And I was like, this is bananas.
Yep.
And so I was like, this girl doesn't even have a high school diploma yet. And she's teaching doctors of physical therapy how to exercise.
Mm-hmm.
I was like, this is a fucking problem.
Yeah, it is a problem.
And then Monday, she was in the gym to train with me. And I go, Brooke, what do you like think of the course and stuff? She's like, I don't get it. I was like, what? She's like, it doesn't make sense to me. I was like, what doesn't make sense to you? She's like, how do these people do their job? I was like, what do you mean? She's like, how do you get people back to doing exercise when they have no idea how to exercise? She's like, no one in that group knew how to exercise at all. I was like, it's a really good question. She's like,
Yeah.
she's like, but she like wanted an answer from me. She's like, so what do they do all day?
Right.
I was like, ultrasound,
Totally.
E-stim, I don't know.
But that's where social media is good in a way where she knows that that's not normal. Like, what the hell is going on with this, right?
Yeah.
You know, and it would be nice though if some of these PTs would be a little bit more vulnerable and say, hey, listen, I don't know how to do that. Can you show me how to do it so I can better help my patients? Because like,
which was really cool. Like this whole
Yeah.
group, I will say, like they were very open to it. They wanted to ask
great.
questions. They wanted to know
Totally.
more. It's like, awesome. You guys are finally
Yep.
getting it.
Totally.
We're a little behind the ball, but like we're getting it.
But that's okay because like now you can better help people. Like, because you know, you can't be everywhere. Like I can't be like, not every good PT can be everywhere, but how do we make more like good PTs, I guess, you know? So I think that's good that they're showing some vulnerability to the fact that they want to get better because they know that it's important. But why wasn't this important 20 years ago?
Yeah.
You know what I mean? That's the kicker where it's like, wow, this is just becoming important now. I think it's just, yeah, it is, like you said, it's bananas.
Yeah. I talk at a couple local universities and stuff too. And I tell like the intro to exercise physiology class, I'm like, get out there now and start working in this field.
Totally.
And I did 7 years hard time at UMass Lowell, and I'm on their advisory board now. And I was like, you don't have any problems with the program? I was like, I do. They're like, what? I was like, you guys wait till the senior class. You're in your last semester of your senior year before you're put on practicum. I go, and in like 3 months from now, this person is supposed to be ready for the real world with all this experience. Is like, they should be doing something like at least by sophomore year.
Totally.
I was like, I think I got far in this field because I started when I transferred into exercise physiology. I became a personal trainer right away, and and so by the time I got to PT school and was on clinicals, all my instructors were like, "Wow, you're really good at talking to people, and like you know how to ask questions, and like you're really good at guiding them on exercise, like more than most students." I was like, "Well, I've been doing this for 5 years now."
Yeah,
and it's like
1000%.
So it's like we have to go out there and do it, not just sit behind a book and like
That's right.
realize there's so much to it of just working with humans.
Oh, dude, it's crazy how many students that call us and they're like, hey, I got to get my hours in. I'm like, hours for what? Oh, we need to get 40 hours in before like the end of the summer. And here we are, it's July. I'm like, dude, you had like a whole year to do this. Why are you waiting till now? Honestly, it's a red flag for me. It's like you're not going to get in here, number one. Number two, like take your life more seriously. But like to your point, it's the same thing. Like back when I was in PT school, like couldn't go straight through. So I had to do a 4-year undergrad and a 3-year grad program. But right after I got my 4-year undergrad, I went and got my CSCS, and then I just started training. And then I did that all throughout grad school. So it's like I already had 4 years under my belt before I even graduated. So I felt like a little bit ahead of the game, but I felt like I still like, you always need more, you know? But I think that a lot of people should want to do that. Like if their passion is really physical therapy in like an outpatient facility or working with athletes, then you should be working with athletes now. Yeah.
And you should be practicing the stuff yourself.
1000%.
Which most people don't. It's just like, I don't understand.
Yep. Like if you can't demonstrate it, like that's a problem,
Yeah.
you know? And I know like my clientele is not powerlifters. My clientele is for sure bodybuilders. You know, I have PTs that are great with agility and power and speed. That's not me. Could I demonstrate it one time? Probably. But that's about it. But I won't claim to be that guy. And I don't want to be that guy. So, and that's okay. Like, but work with the type of people that you want to work with, you know? And that's the main reason why, you know, I have my other PTs because like, I don't have any interest in that, you know, but they do. Great. You know? So it's just a good match for being able to kind of see all populations, you know?
Yeah. Do you think it's worth still being a physical therapist?
Oh, this is a good question. And this is
we were doing pain screens at a gym last night, and this girl, I was speaking to like interns and stuff. I was actually really impressed. So this girl emailed me, and she was like, "Hey, I know I probably missed the boat on, but she's like, I was wondering if you still had any like opportunities to intern and stuff." She's like, "I'm thinking about PA to school, NP school, PT school," and I was like, "She's like, could I come by? Whatever." She's like, she goes to the gym that I was doing the pain screen. I was like, "Well, just stop by then." And she came by and she sat there for an hour and a half and wait. Like we got more and more people just kept walking up for these pain screens that we were doing.
Yeah.
And she sat there for an hour and a half, like in the waiting room or whatever waiting area, and then like just to talk to me, like ask me questions about stuff. I was like, really cool that you like sat there that long and like you messaged me beforehand to confirm like you
Totally
had questions like prepared. I was like, a lot of interns don't do that. But I said to her, I was like, she's like, "Yeah, I don't know what I want to do." And I was like, "Well, do you like money?"
Yeah.
She's like, "Yeah." I was like, "All right, don't be a PT. I'm just, I'm really curious. Like, what are your thoughts on where the field goes in the next 10 years from like a business standpoint?
Honestly, man,
Or practice model.
Practice model. Yeah. I honestly think that a lot of people are going to start gravitating towards the model that we have. And I think that's for the main reason of reimbursement and pay. Like, reimbursement is the way it is because the reimbursement hasn't changed in 15 to 20 years.
It's gotten worse.
It's gotten worse, actually. Yeah. So you can imagine why the PT salaries aren't moving either. And this is a direct relationship to that. So don't blame the PT place that you're working for, but blame the insurance. You know, blame our profession for not, you know, standing up for the reason why reimbursement rates aren't better. You know, like if you had asked me, and we get students like this all the time, like they ask me, "Hey, is it worth being a PT?" And I answer the same question as you. I'm just like, you know, do you want to be a PT because of the money? That's always usually my first question. If the answer is yes, then you might want to choose a different profession. You could make just as much, if not more money, being a really good personal trainer, you know, that has taken
or anything else
or anything else. Yeah. Or anything else. Yeah, for real. But the return on investment is not there. And college keeps going up. Like if you got a full ride or something like that and you want to do PT, whatever. But the return on investment is not there. Like back when I went to school, it was 30K a year. That was room and board. You know, nowadays it's like 60, 80, 90 grand. You know what I mean? For an undergraduate education, like that's totally not worth it. Mm-hmm. It's a kind of a waste of money, to be honest. And if you're really looking for like physical therapy, like, I mean, shit, you could be a PTA for less money, you know, and still, if you want to treat patients, now you can't do evals or anything like that, or you could be an AT, like, you know, there's so many other options. Like if you still want to like work with athletes than being a PT, you know, and that's not me discrediting the profession. I think the profession is great. Like I don't have any regrets with being a PT because of the decisions I've made, but not every person is going to make the same decisions that we make. Right. And then they get stuck in the traditional model of PT where they're seeing 2 to 3 patients an hour and they're burnt out and they change careers in 3 to 5 years. And that's just what happens. So I think the only way that you can change the narrative of PT is you have to change it for yourself. And that's what we did. And if you're not willing to do that, then I wouldn't become a PT. Like if you want to go there and you want to do your 9 to 5, then pick another profession. If you want to go and you want to start your own thing and do like some really cool things in your community and like start your own business, then I think it could be great. But I also think that you have to kind of weigh in all the options.
Yeah, I agree. Like doing what I did, I don't regret it. And I love what we do and I have purpose in life.
Totally.
And I can, granted, I as a business owner can make a little bit more money sometimes.
Sure.
This year, like reimbursement got cut by 10% for us. Yep. And it's like, shit.
That's right.
But I still wake up and love what I do every day. I've never had a day I dreaded.
That's right.
Because I get to make the decision on what I'm doing that
That's
day.
Right. That's right. And you get to control. You have the control, right?
Yeah.
Like you control whether or not you have a job, you know, but by hard you want to work.
Yeah. But I saw my business mentor just put up a video. The average PT is a PT for 8 years.
Yeah.
And then leaves the profession.
Honestly, I'm surprised it's that long.
Yeah.
Yeah.
But it's crazy.
Yeah.
To go to school for 7 years, only do it 1 year longer than that and be done with it.
Crazy.
Yeah.
Crazy. But honestly, I think that's because of the decisions they made, right? Like it's the model that they were working in. Like I could see that.
Yeah.
You know, totally. I get it. I totally understand. But also like, if you're going to be a PT, do your research, like know that that's the possibility for you. Like if that's what you want, then fine. but also know like it's not everything that you see on social media that you're putting out or what I'm putting out. That is not the normal PT situation, right?
Yeah.
And you have to understand that and know that finding a job in a facility like that is probably not going to be super easy. You have to be not only really good at what you do, but you have to be lucky. Like somebody has to be leaving or you have to be looking for a new PT at that point. Like that's just how it works. So
you have to market and brand yourself really well. To get into a place like that.
1,000%.
Yeah. I'm curious, like one thing that's been a new concept lately, like very recently is where AI is going. Like it's been around for a couple years now, but now it's like, oh, there's some weird, crazy shit happening.
Sure.
And I'm like, I'm not replaceable, I don't think. Granted, like insurance companies are trying to do all these things. So like, well, use our virtual representative to ask a question.
Sure.
But it's like, all right, the computer can't dry needle you. Computer can't shockwave you. Unless we got robots to do this, which like we probably got another good 10 years before.
Yeah.
And people still like human connection and socialization with us. Where a lot of other people are like super worried about their jobs.
Yeah, of course.
Where even when I think about like a medical doctor, like, are we going to need primary cares? All they do, like, they don't really put their hands on you that much. We can do that.
True.
Where we're the ones putting our hands on people all day. And how does that change the need for us? And I'm like, is there going to be a flip at some point where insurance decides we are necessary and they should pay us more?
Right.
Because everyone's going to start leaving the profession, or we're all just going to be independent, small micro clinics.
Right. I mean, to your question about the insurance, I don't really think insurance cares.
No,
I think because they're going to get paid either way. So if there's not somebody in their area that doesn't provide an insurance network based practice, they're going to be like, then find somebody that does. Like, they don't really care.
Yeah.
To your question about the AI, I don't think that we can be replaced in the service industry like that. However, I do believe that if you're not utilizing AI, then eventually you're going to have to evolve. If not, you're going to be replaced, like your practice. So I think if you're not evolving with AI and you're not making your life easier and you're not utilizing the nice like things that AI can provide, then I think that you're going to fall behind. And like to your point, I don't think you can replace that human connection. And I'm not willing to do that either. Like I will never replace a front desk staff. I will never replace my PTs like in that regard. But if we're not using AI to help us, become more efficient and run our clinic to the best that we can, then I think we're gonna lose.
What are you guys doing to use AI?
So honestly, right now, I use it a lot with like the editing for clips for social media. We use it a lot for almost like reviewing and grammar checking whatever we're putting out online. That's pretty much to the extent that we're using AI. I honestly think we're behind the ball just a little bit with the AI, but it has made our life easier in the fact that it takes less time to put stuff out. Like for example, I will use AI to because we're pretty good with like we put out a newsletter, we put out a blog, but I can use AI to chop that blog up into a social media post for me. So it's like you're 2-for-1 deal. You know what I mean? In that regard. But I wouldn't say that we're using it to replace what we do. Like what we say is not going to be replaced with AI because we want it to come from us. So I don't know. How have you utilized it?
It's funny. I was thinking of this the other day because I'm in this new mastermind that has a lot to do with integrating AI into your practice. And I think Anthony, my operations manager, I don't know, maybe it was like a year or two ago that like ChatGPT came out.
Yeah.
I don't even know how long ago it was.
Yeah, it was about that. A couple of years.
But I was like, what is this? It's like, I was like, an 80-year-old that was just handed a cell phone. I'm like,
totally.
How does this work? Like, what am I supposed to do?
Yep.
Like, you don't know how to interact with it.
That's right.
And now I'm doing some different stuff with it. I'm like, oh. And I was telling my girlfriend the other day too, because she hasn't used it. She works a regular job in a hospital where like AI is not used yet. And she's like, I've heard about it, but I was like, yeah, this is, we talk about my work and stuff. And I'm like showing her, she's like, that's fucking insane. I was like, yeah. But I'm like, it's basically like a human you like bounce ideas off of and it gives you information and perspective. And so yeah, we're using it for cutting down time on just like written tasks. Like
exactly.
Like the other day I needed a short bio for the advisory board thing I'm on.
Yep.
I was like, ChatGPT, write me a short bio about myself.
Yeah.
I was like, well, there's 3 Brett Scotts, Dr. Brett Scott. So it's like there's the physical therapist, the neurosurgeon, and the writer. I was like, all right, the physical therapist. I was like, boom.
Yeah.
Okay, cool. Make flyers. It can make flyers now.
Yep.
I was like, punched all this information. So the pain screen we did last night, ChatGPT made that flyer. We're using it for that. The sales trainings. So yeah, the mastermind I'm in, they created a GPT, which a lot of people don't know. You can use ChatGPT to make your own. I forget what GPT stands for. It's like generating.
Yeah, prompt text or something. I'm not even really sure. Yeah, I'm not even really sure.
So we can now record our sales conversations, whether it's in person, you come in for a consult or something, and I have someone in training, or you're on the phone. I can put that conversation into the GPT, and it will grade me on each area.
Yeah, that's cool.
As well as tell me where I can improve.
Yep.
And tell me how to handle that objection better and work around this, which is pretty cool. Programming stuff now.
Yep. I know a lot of people that use it for programming.
We're getting into more of a we're starting to do like a hybrid digital product with physical therapy. And so we're looking at using GPTs for that. And what I'm starting to do is take, like, what's really cool I learned is you can get ChatGPT to like framework your brain. So I prompted it to ask me every very in detail question, basically about how my brain operates and thinks critically about my clinical decision making. And so it gives you, so I gave it this prompt that I was given from my coach, and it pumps out, it's like, all right, I forget the exact wording. It was like a paragraph, but then it's like, all right, like, what is the first thing you're looking at when a patient walks in the door? And it even tells you, it's like, are you looking at their demeanor, the way they're walking? Are you looking for apprehension? Like, are you assessing gait, whatever? And I'm like, all right, I'm thinking about, like, you know, is this person an expressive personality?
Sure.
Do they seem apprehensive? Are they walking with a limp? What is their tone of voice? Do they seem scared, anxious?
Sure.
And then it's like, okay, like, what's the next thing you do? Like, what do you do next? It's like, well, we sit down and we go through our subjections. Like, okay, what are the main questions you ask? And why do you ask them? And then it's like, okay, based on that question, like, what are you looking for? And like, if you get this, are you getting that? Like, I was on this thing for like 4 hours. And then it basically gave me a flow chart that I can now use to train all my staff with.
Interesting.
Yeah. And like, basically it's like a way to almost like patent your model of thinking.
Sure.
So that was really cool.
Yep.
So starting to do stuff like that. Of like,
I really think that it's and learning how to use it, I think, is super important. Like the conference that I've gone to talking about AI is learning how to prompt it correctly so that you got to have to give it the most amount of information you can so that you can get what you want out of it.
Yeah.
Because if you don't know how to prompt it, then it's really no good to you. And that's really the important thing. But yeah, it's crazy what it can do. Like, I was at a conference. This guy was like, he was literally went on the phone it was like a 5-minute phone call. And it was this, I can't remember what the company was called now, but he basically was going to use this company as his VA. Right. And it was like, ask me certain questions. Right. So he'd answer certain questions. And obviously the big thing is like, don't tell somebody what the price of what my service is. I want to be able to talk to them about my service. So after he was done prompting the AI, then it would go on a mock call, and then he'd call and pretend to be the patient or the client or whatever, and be like, no, I just really don't want to know how much it costs. And the AI would kind of turn the conversation around and not talk about cost, to the point where if like you say it enough, it's like, all right, well, I may have to have so-and-so contact you, blah, blah, blah. So it's like, it really does know how to do it. You know what I mean? It's pretty wild what's possible.
Is that Delphi?
It might be Delphi. Actually, yes, that sounds familiar.
Because you use your voice and everything.
Totally.
Too.
Yeah, it's crazy. It's unbelievable. He did it in front of everybody. I was actually blown away. And right after that, I was like, oh God, here it comes. It's coming. You know what I mean?
That's what it's like, oh shit, there's a lot of replaceable jobs out there.
Totally. And honestly, for a solo practitioner, it might not be a bad idea. I don't know. Like, I mean, I'm not in a position where I need that, but like there might be some people that are, and it could be really cool, you know? But I think it's coming. And I think that I don't even think we've tapped into the actual potential of what it actually is.
No.
So, but yeah, we use it for images all the time as well. And we use it for systems. Yeah. We've done that as well. It's kind of wild, like what it comes out with.
I think even, speaking of images, like MRI, CT scans.
Totally.
I'm pretty sure you can put them in
You
there
can.
and it'll give you, granted, I don't know what the chat GPT is not always right.
Sure. But I've seen some research that the chat GPT has seen some things that the x-ray techs have not seen, or even the doctors. So it's, I think it could be important to like throw in there, you know what I mean? And just say, yeah,
quality assurance.
We want to make sure we didn't miss anything.
Yeah. It really is. It's like,
totally.
How many things get missed in the medical system?
Dude, a lot.
It's like, how many errors could we solve with it?
Totally. So I think it can be good, but it can also be bad too, right? Like if it replaces people's jobs, I understand that. But also like, and for us, it might not be replaceable in that regard, but like big companies for sure. Like they're going to, there was one guy that made a speech saying, hey, listen, I'm going to replace probably about 60% of my employees with AI. He goes, because AI, it's a flat cost. And he goes, they work all the time. They don't have time off. They're always working. And I'm like, that's a really good point. I mean, how can you beat that argument? You know what I mean? Like, you don't got to pay them overtime. They're there. You know what I mean? So I'm like, yeah, I guess. And then I'm just thinking of it's still not applicable to our model, but how can we utilize it still? Because obviously there's some great things that can help us,
Yeah. It's just what happens when ChatGPT inevitably gets hacked someday.
Totally.
And
it's going to happen, I'm sure.
And my thing too, my concern is like kids now in school learning, like,
yeah. Oh,
not to sound old.
I got a crazy story about that actually.
Not to sound old as shit, but I'm like, back in the day, I had to actually learn stuff.
That's right.
And now, like, I'm like, school would have been so much easier if I had ChatGPT.
I know.
Like, how do we get around it? To act like, if you're an emergency room doctor, you can't rely on ChatGPT to, run through all these checklists in your brain that you need to go through to rule this in or out, or this means I need to give this medication, or they need CPR, whatever the case may be. What artery do I cut?
Dude, it's crazy. And honestly, like it really does make me nervous for like upcoming professionals in the healthcare industry, because like who actually passed for that grade? Was it ChatGPT or was it Dr. Smith? You know what I mean? Because we don't really know. And it's funny, I have a teacher that works at the college level, and a lot of kids nowadays are using ChatGPT to write essays or write it's wild. But now, I mean, they have the technology to be able to determine whether or not it was AI driven or not. And she will run these things through the machine or through the however she does it. And she found out that about 80% of the kids in the class all used AI to write their papers. That's crazy. 80%, over 80%. It's like, I mean, and then what do? You know what I mean? So it's like, who actually wrote the paper? Who's actually learning here? So I really think AI is a blessing and a curse. And I think it could be a curse in that way, saying a lot of these people are going to lose the ability to be able to make these clinical decisions because they relied on ChatGPT to do that for them.
Yeah.
You know what I mean? So that's what kind of scares me. I mean, it's a great resource. I think a lot of people are using ChatGPT instead of Google now, because it's just like, hey, ChatGPT, just ask them a random question instead of just typing it in Google. You don't even have to type. You can just talk to it. That's what I'm saying. It's crazy.
What do you use for, what software do you use for editing? Because we do editing too.
So I actually just started using this one called Descript.
Okay. We use Opus and I don't love it.
I used Opus before. I didn't love it. I like Descript better. And this is one that one of the people at the conference that I went to last recommended I use. Okay. And he's like, try it, see what happens. So I did. And the way I can cut the clips, the way I can it's just easier to use for me anyways, Opus I felt like was not as easy to navigate, but the Descript, you should try it. It's a lot easier to use.
I'll give that to the VA.
Yeah.
But I'll take a look at it. But yeah, those are the crazy parts that I'm like, that makes me very curious about like how many cool things we're going to be able to do and help and prevent, but also like, we're fucked if everyone's relying on ChatGPT, especially in school. From like like elementary school kids are using it now.
Yep.
Even
I know. I mean, I can tell right off the bat if somebody wrote something or not. You can tell. I mean, when you put something in ChatGPT, puts those hyphens in there. I'm like, why do people don't know that like that shit's like driven by AI? AI just loves to throw those hyphens in there. You know what I mean? Where it's just like, I don't even know if I can show you, but like it's basically the way it's written, and then it'll be like, hyphen, and then it'll be like whatever they're saying after that. And it's like AI put that in there because it was like their interpretation, but you could totally change that. You know what I mean? But some people just leave it there, and it's like totally evident that you didn't write that, So
I have a guy too now that really cool patient. He works for Google.
Yeah.
And he's a developer for Google.
Yep.
And he's like, I guess he's writing a book for Google right now too.
Oh, interesting.
Which is like, not everyone gets to write books
Totally.
for Google. And he used to be a professional hacker and all this too. Like he's got some really cool stories.
I bet.
But he was saying like the scary part about AI now too is that I had this like perplexed conversation where it was like, wait, what? Because he was like, yeah, now like AI was computer generated. Now AI is learning what humans are teaching it to do to be more human.
Right.
And so like we're going to reach this point where there's no difference in what the computer knows as human versus us. And so it's like molding these two things. And he's like, that's going to be a giant problem.
Totally.
And it's like, oh,
interesting.
Yeah.
Yeah, that makes sense.
Yeah.
Where it's like evolving.
He said it much better than I just did.
Yeah. No, I get what you're saying.
Yeah.
That makes sense.
These two worlds of humans and computers colliding where like there's going to reach a point where you're not going to be able to tell the difference between a computer and a human.
You can already do that now. Like I've seen clips of like AI, like an AI clip of like a video. And it's like, I can't tell if those are real people or not. Like you can maybe slightly, but it's hard.
Yeah.
You really have to look at it. But obviously that's only going to get better with time. Dude, movies are probably just all going to be AI driven. All these actors are going to be out of a job. Like
even like there's like videos now. I was looking at one Alex Hormozy put up. There's one you can put like your face and voice, and you record a couple clips.
Yeah, and
then you could record one. It's like, hey Brett, this and that, and then like you can automate it. So like you type it in. It's like for you want to broadcast. Automated messages, but it'll be a video of like, hey Michael, and I never said Michael.
Right. Yeah.
But it'll make your mouth. Voice Michael in like a video chat or whatever. And
I can see that.
So yeah,
because then you really don't know who you're talking to. Yeah. I don't like that.
So it's
but that's definitely the way it's going, no doubt.
Yeah. So anything? How long are we going now? Hour 20. Anything else you want to talk about?
I don't think so, man. I mean, I think we covered it.
Yeah.
I love the fact that like doing stuff like this just creates like, a better sense of what we do and what's capable of PTs, like what's within the scope of our practice, and, kind of get people to kind of reach out to, try new things and like walk that line,
I'll say too, just to give a shout out to your staff.
Oh, cool.
Because we were talking about functional medicine stuff before when me and you were talking and met up, but talking to Nick that works for you, your other PT.
It's like the smartest guy I know.
How do you say his last name?
Sienkiewicz.
Okay.
Yeah, it's Polish. Took me a long time to figure out how to write that.
It's really cool what he's doing in physical therapy too, with the functional medicine thing.
Yep.
Of like, that was another thing when between like I've been misdiagnosed with an autoimmune disorder and a parasitic infection, been through functional health and stuff a bunch now. And it really intrigues me of like how we attain optimal health. I was like, how do I get into this without pushing?
Right.
Like, what is my scope of this stuff?
Right.
And like, I can look at labs and tell you about them, but like, and like talking to him, he's like, oh yeah, you can order labs and
totally.
And he's like, I'll order stool samples and do all this stuff.
He does it all the time.
And I was like, what? I was like, that's so fucking cool that like, not only is it you,
right,
but like you have and like, I was like, hey, can we get on like a call? I figured I'd be on there 15 minutes. Like, how did you get into this? Like, tell me what course you took to like get certified and learn. Nick talked for an hour.
Dude, you can't get him to stop.
I usually like, I'll take, so it's like a quarter mile around my complex here. I'll usually take him for one lap.
Yeah.
We did like 8 laps walking through here. Just like, I was like, all right, dude, like I need to go. His baby's kind of like, dude, like if you need to go, he's like, no, it's fine.
He loves it. Dude, he loves it. And it's funny, like, and that was a like perfect example. Like 3 or 4 years ago, Nick's like, dude, I think I want to get into functional medicine. I'm like, I don't really know how that works in this profession, but fuck it, let's go. So I was like, what are you going to do? He's like, I already got to figure it out. This is the mentorship I want to take. I was like, dude, are you really into it? He goes, dude, I'm like into it. I'm like, all right, cool.
Yeah,
so I supported him. I paid for it for him. I'm like, let's go. Let's get this done. Let's see how we can implement this in the practice. And dude, just that's what that kid lives for. You know what I mean? And it's such a great compliment to what we do. And like every patient that he has, something comes up in conversation. Like I'll be working on a patient next to him and the patient will look at me like, damn, did you know that? I'm like, nah, I had no fucking clue with that. Yeah. So like, it's like stuff that he's like always researching. This dude's like one of the smartest guys I know, but like, yeah, it's a perfect example of, you would never think that those two things could go together, but they go together very well, you know, and why not do it? Like, you know what I mean? So, and like you said, a lot of the companies that we work for that he orders the stool samples from, we can do that. Like we can order it right from the click of a button. You know what I mean? So, which is really cool. And I think that's just the thing. Like, you know, this is going to become more widespread. Like what else can we push this to? You know what I mean? Yeah, it's labs, stool samples, all this stuff, but like, you know, could we become more of the primary care provider in a way, you know, not take the primary care provider's role like job, but let's be honest, like you said, like we see these patients very often. We know these patients very well, probably a lot more than they know their primary care physician. So why don't we just take this opportunity and see if we can help them even more? So yeah, I love it. It's great.
Yeah. So just to give you a plug here, you guys are in Salisbury, right?
We're in Salisbury, Mass. Yep. Salisbury, Mass, ProForm Physical Therapy. So yep, it's only one location. So it's and
you guys do PT, we do
PT training, small group training. We do a little functional medicine like we talked about, but yeah, that's for the most part, that's about it.
How many staff members do you
have? We got 5 right now. Five total.
Okay. Yeah. So we're about the same size.
Yep.
We should do like a dodgeball game.
Dude, that would actually be fun.
Barbell therapy versus ProForm.
Dodgeball game. I love that idea.
I think I mentioned that to Nick too. I was like,
dude, Nick would totally be down.
Yeah.
Like Nick's like Nick and like my other PT Hayden, like they're big into event. Like Hayden just did Ironman. You know, Nick's training for this like Reach the Beach thing. So it's like they're always down for activity. We're always down for that shit.
I got a Nick PT too.
Yeah, so there you go. Perfect.
He's a high rocks guy, but
that's awesome. That would be awesome.
That'd be like a fun night out.
Dude, we would totally do that.
Yeah.
We would totally do that.
Yeah.
We'll get that on the schedule.
Cool. Sounds good. And how can people reach you if they want to learn more about what you guys do or interested?
Sure. Yeah. Our website is www.proformptma.com, or you could just reach out to us by email. All that information's on there. Check out our social media at ProForm PTMA. And, you know, we put up a lot of important information, but we also like to have fun with it too. So yeah.
Well, last question. Do you ever wear anything that's not ProForm?
Dude, I live and die by the brand.
I heard that from you before.
And I say this because how many people do you know of that own a business but don't rock their own shit? It's like, why do you do that? You know what I mean? I was like, I wear the shit to bed. Like if I could have ProForm underwear, I would wear them. That's how much I believe in our company. So that's, and my staff's the same way. So I love that. Yeah.
But do you ever wear anything else?
Sometimes on special occasions, but it's only because my wife makes me, because she hates seeing it. But other than that, it's pretty much every day.
Yeah. I'll have to find out. Like you got some like nice clothing.
I love the swag, man. I spend money on swag. I love it.
Yeah.
Yep.
The
walking advertisement.
Pants, yeah.
Hell yeah.
Cool.
For sure.
All right, man. Well, thanks for coming on,
cool.
and we should do this again sometime.
Absolutely.
Yeah.
Cool.
Cool.